Dr. Fredric is a cosmetic surgeon, and he's here to show us the newest sunscreens that can protect your skin this weekend and through the summer. Good morning, Dr. Stern.
Morning.
Appreciate
Great day to talk about sunblocks, isn't it?
Yes, absolutely. What's new here? Because I recognize some of these products. The copper tone is very familiar,
right,
and so is this Neutrogena here.
Right. These two are very familiar sunscreens, and this is a lot of what you'll see in the drugstores. And basically, what you want to look for in a sunscreen is you want to look at the SPF factor, although a lot of people don't realize that SPF really is a rating system that just applies to UVB. And UVB is the ultraviolet rays that cause sunburn, suntan, skin cancer. But UVA really should be blocked as well, because UVA is what causes a lot of sun damage and aging of the skin.
I see.
The wrinkles.
Okay.
And those are what you want to prevent.
So the UVB is the one that's more harmful, but UVA is the one that's more cosmetically concerning.
More cosmetically concerning, but there is some evidence now that UVA also causes cancer of the skin. So you really want to block both. And what you want to look for is something that says broad spectrum on it.
Okay.
And the latest sunscreens, which I really, which
Where would
are
it say
here on
that?
this
Would
side.
it say it right on the front?
It should say it right on the front.
Okay,
it should
so
say
UVA,
broad spectrum
UVB
or
protection.
UVA, UVB protection.
Okay.
That's right. You look for those two words, one or the other.
Let me just ask you something really quickly. This is a generic and this is a brand name. Does it matter?
It doesn't matter in general as far as the active ingredients go. The differences tend to be the vehicle that it's in, meaning the cream or the lotion, the quality of the cream or the lotion. If you look at these two, put a little bit on your hand and test it as I did earlier. The generics tend to be a little bit thinner, a little more watery.
Really? Harder to rub into your skin?
A little
maybe
harder
take
to
a little
rub
more
into
time?
the skin. Maybe whether or not they'll wash off a little quicker is hard to say. But the vehicles tend to be somewhat less expensive and not quite as good. So that's one thing to look at. But they're equivalent as far as the effectiveness of blocking the sun.
And now, titanium oxide and zinc oxide are two of the products that we're seeing more, two of the contents that we're seeing more and more in these products. This one is new. I haven't seen this before. This is only from your doctor?
Right. This is made by a company called SkinCeuticals, which makes a terrific line of skincare products. And they have a new form of zinc oxide called Z-Coat, which is a clear micronized particle form of zinc oxide.
And for people who don't recognize zinc oxide, that was the white stuff that your lifeguard always used to wear.
Exactly
that's pure form of zinc oxide,
That's pure zinc oxide, 100% blocking of UVA and B. But the Z-Coat, which is zinc oxide micronized particles, reflects the UVA and UVB rays. It doesn't absorb it, it actually reflects it. And it's a terrific sunblock, broad coverage for UVA and B. There's one other UVA blocker, which is excellent, which you can buy over the counter as well. And here's an example of it. It's called Parsol 1789. There's the fancy chemical name for it, which is avobenzone. But basically, if you look for that, that also is an excellent UVA blocker. Okay,
one quick question. We have to wrap this up. But I noticed you have SPF 30 and 45 here. There is so much information out there that says you shouldn't even bother with anything over 15. What's the right information?
Well, I believe the right information is that you should go, really, I recommend 30 or higher. And there is a slightly increased benefit of going to the 45s, anything above 30. 30 is great. It blocks about 97% of the UVB. Don't forget, we're just talking about UVB blockage with the SPFs. 45 will block about 2 percentage points higher than that. So you are getting some added protection.
Okay, but again, apply
at least
30 minutes before exposure, at least?
20 to 30 minutes beforehand, skin should be dry and clean. And one other quick point is that these products do have shelf life. So if it's been sitting in your cabinet for over 2 years, you should probably toss it and buy some new product.
Reapply when you're out there.
Reapply every couple of hours.
Okay,
that's right.
Dr. Stern, a pleasure. I have some sunscreen on my hands, so I'm a little slippery right here. Sam.
Thank you.